Hi, my name is Rochelle Franklin, and I'm going to be performing the head to toe assessment on my patient. All right, so first we're going to start off with hand hygiene. Going to wash for at least 20 seconds, making sure that you get into all the crevices, okay? And just for time purposes, we're just going to go ahead and introduce ourselves to our patient and start in on our head to toe. All right, so this is our patient. Hi, my name is Rochelle Franklin. I'm going to be your nurse today. We're going to be performing a head to toe assessment on you. Can I have your full name and date of birth, please?
Jacqueline Brown, 11/3/1966.
Perfect. All right. So I'm just going to don my gloves, okay? All right. And can you tell me if there's any issues with anything going on right now, skin-wise, eyes, ears, nose, throat, anything like that?
Yeah, I've been having a little trouble hearing. It's not so clear, so
Yeah.
Yeah.
Hi, my name is Rochelle Franklin, and I'm going to be doing the head to toe assessment today. All right, so we're going to start off by washing our hands. We want to make sure that we're washing our hands for at least 20 seconds and making sure that we're getting all the crevices, fingernails, in between the webbings of our fingers. And once we're done, we'll go ahead and dry off our hands. All right, so I'm going to go ahead and introduce myself to my patient. All right. Hi, Miss Jackie Brown. This is our head to toe assessment. My name is Rochelle Franklin. Can I have you verify your full name and date of birth for me?
Yes. Jacqueline Brown, November 3rd, 1966.
Perfect. Thank you so much. So, have you ever had a head to toe assessment before?
Mm-hmm.
You have. All right, perfect. So we're going to start off with vitals. Our patient's blood pressure is 129/80, so in the perfect range. Pulse is a little high at 93, but that's okay. She's a little nervous. And respirations 18, temperature 98.6, and SpO2 is at 98%. Okay? All right, so I'm going to go ahead and don my gloves, and we'll start on your head to toe assessment. So, Miss Jacqueline, I'm going to be touching your head, okay? So I'm going to start by palpating your head, making sure no lumps, bumps, or crepitus is going on. I'm also looking for any hair loss, patches, abnormal bumps, like I mentioned. Then we're going to go ahead and look at Miss Jacqueline's ears. We're going to look behind the ears first, expecting for any bruising, and nothing's there. I'm also going to be looking inside the ear, making sure that there's no flaking of the skin, any abnormalities that we might note. I'm going to go ahead and look in her ear. And then I'm going to look in the other ear. Looks fantastic. All right. And then we're going to look, we're going to start with her eyes. So, Miss Jacqueline, I'm going to have you stare this way, and I'm going to shine this light, and we're just going to see how your eyes do, okay? Looks like she has Perla. Eyes are equal, round, reactive to light, and accommodating. I'm going to go ahead and have you follow my finger, but don't move your head. Perfect. All right. And then I'm going to do your nose, okay? So if you can plug one nostril for me and blow through it. Perfect. And then the other side. Perfect. All right. And I'm just going to inspect the nares, make sure that there's no deviated septum or any abnormalities like nasal polyps or anything like that. Next, I'm going to be checking her sense of smell. So if you can, go ahead and smell this. It's just coffee grounds. Smells like coffee grounds? Okay. Ah, awesome. All right, and then I'm going to be doing the tuning fork on her. This should show if there's any small bones that are cracked, fractured, broken, or if she has some sinus issues. I'm going to go ahead and palpate her sinuses. Anything? You feeling anything? No? Perfect. All right. And then I'm going to go ahead and look inside her mouth. Say ah for me. Uvula looks great. She does have her tonsils still. Nothing's red or bothered or inflamed. I didn't see any white exudates. Tongue looked great, pink in color. And then can I have you grit your teeth? Perfect. Teeth are good. And then also good gums. And this is also a cranial nerve that we're going to be checking. So she can grit her teeth, which is perfect. Can I have you raise your eyebrows? Perfect. All right, you can relax. All right, next thing that we're going to do is we're going to assess her lymph nodes. So we're going to start off with her neck, and we're going to go around and assess the cervical spine as well. And while we're here, we might as well check pulses, see if there's anything. Trachea is not deviated. There's no rigidity, no issues, no lumps, bumps, or any abnormalities. And we're going to go down all the way to her cervical. All right, and we can check her armpits at this time as well, checking those lymph nodes. Everything looks great. So next, we're just going to go ahead and I am going to listen to her heart and lungs. All right. A couple deep breaths in and out for me. Perfect. All right. And can I have you stand up and turn around for me? All right. And I'm just going to be doing it in a zigzag motion. Our lung check. Deep breath in. Awesome. Thank you so much. And if you don't mind, you can have a seat. And if you can lay down for me. So we already checked out her lungs. We're going to go ahead and do the heart, and then I'm going to move down to the abdomen. All right, so just breathe normally. Perfect. Her apical pulse is fantastic. It is matching up with what we checked earlier. We might as well check her carotids again, check her bilateral pulses down here since we're already there, and I checked her apical. And then we can check her popliteal as well. And also the tops of the feet, the pedal pulses down here. Everything's perfect and sounds great. We're going to go ahead and do the 4 quadrants of the stomach now. Okay, so just breathe normally. Just going to be listening to your belly. Okay, and all 4 quadrants did have some bubbling, some gastric juices flowing, so that's always a good sign. We want to make sure that our patients are having regular bowel movements. How are you doing on your bowel movements?
Good.
Any urinary issues?
No.
No? Perfect. All right, and I'm just going to go ahead and palpate your stomach now. So we want to go in all 4 quadrants in a wave-like motion. And, you want to go medium to deep. And, of course, any issues with the bladder? When I just pressed on that? Perfect. So, no bladder issues, no incontinence issues. And I'm looking at her muscle tone while I'm also doing this. And her muscle tone seems appropriate. Next up, I'm going to have her walk over and we're going to do the Snellen chart. All right? Thank you so much, Miss Jacqueline. So we just verified that the gait is appropriate, And this is Miss Jacqueline with the Snellen chart. Can you go ahead and cup your left eye for me? Perfect. And can you read off line 4?
LPED.
Perfect. And we're going to repeat that on the other eye. But I think for the sake of time, we're good to go on her eyes. I assessed her gait when she walked up. I assessed her ears, nose, throat, her hair and skin turgor. I can go ahead and assess now since she's standing. Any skin issues at all?
No.
Perfect. So turgor, I'm going to check to see how her elasticity is. If she's cold, clammy, she's warm to the touch, so we're good there. I'm going to go ahead and do the cap refill. And she does have painted nails, but we can see on the other side, do you mind flipping for me? That there is less than 3 seconds for a cap refill. So we're good there. And any, extra nails, growing, fungus, anything like that, doesn't look like it. So you look great. All right, any questions for me, Jacqueline?
No.
Okay. All right. Thank you for watching me. Once again, this is Rochelle Franklin for the head to toe assessment. I'm going to go ahead and doff my gloves and perform some hand hygiene. And thank you so much. Have a good day. Bye-bye.